Now let's talk about clogged ducts. First, tell me what that is, because I'm wondering if I experienced it. I think I did.
Yeah, once the engorgement comes in and you're
right.
not frequently feeding or emptying of the breast, and you kind of feel like these balls around your breast. So those are the clogged ducts, and those are really, you really have to stay on top of those, because then it could lead to mastitis.
Okay, so what is mastitis again?
Mastitis is once you get the infection.
Right. Does that mean you have to then stop?
No, you can still breastfeed with mastitis, and we recommend, because you need to empty the breast, so you'll just be put on antibiotics, but you can continue breastfeeding as normally. It's just to relieve your pain, of course, you need to empty your breast.
I didn't get mastitis, but I remember just producing so much milk. I was emptying my breast a lot, and it was just constant. And every few hours, I would get the clogged ducts, and the pain was overwhelming. And the doctor told me to massage my breast, and I pumped a lot to help alleviate the pain, and that helped me also store milk. But here's some clogged ducts while breastfeeding. You can engorgement, which is extremely painful. Infrequently skipped feedings. Can we chime in on that?
Right, so I mean, there's moms that there's just strictly pumping, then they start going longer. You're supposed to pump every 3 hours if you're going to use the pump. So the longer you wait in between pumping sessions, then you're more at risk for getting clogged ducts. And then once you get those clogged ducts, it's important, like you said, you should massage when you're nursing. You could also massage when you're pumping. It also relieves if you put some warm washcloths on your breast, maybe after a shower.
I did that.
All those things help you. Also, when you breastfeed your baby, wherever his chin is pointing, it kind of helps you get those clogged ducts. So try different positions while you're breastfeeding to help you get all over the breast. All
right, and pressure on the duct?
Yeah, that pressure on the duct is from the clogged ducts. So
okay.
That's how they get clogged, because there's just so much milk that it causes pressure, and then it clogs them.
And then, of course, inflammation, and if you nurse frequently, that helps a lot. When you're having this conversation with a new mom, and you're telling her all this, is she just kind of staring at you going like, wow? I mean, because it can't be overwhelming just to hear it.
No, it is. And I mean, there's some that are just like they can't really, process everything, and they can't believe how difficult they feel it's going to be. But like I said, it gets better. And then there's some that are like, they were pro breastfeeding, that they're like all for it, and then they're just happy to hear all the information that they can get to, facilitate it for them.